My name is Professor Dr. Sami Swede. I am a maxillofacial surgeon. I am also the head of Academy of Ritter Implants, and I am going to show you on this jaw model how we can insert Ritter implants in the lower jaw. Before we start with our insertion of implants, I would like to show you everything we need in order to perform this operation. We have on the right side the physio dispenser, the motor, which we need for drilling, and as we can see, we have 800 rounds per minute, which is very suitable for insertion of implants or for drilling for implants. It is possible also in this physio dispenser to make the number of rounds as high as possible till 2,500 rounds per minute. In the middle we have the toolkit which we need for drilling and for inserting the implants of the Ritter implant. And as we see the cover of the toolkit, and on the other side we see all instruments and drills which we need for the insertion of the implant. We see on this roll here, in the last one, we see different kind of drills which are in conical form. We see here the extending tool. We see here the countersink for higher diameter and for lower diameter. We see the punch, and we see three trepan drills in different diameter. One roll more inside, we see drills which are in short form, and one roll more we see the normal drills which are also in the starter kit we have in for Ritter implants. We see here the first drill is the marking drill. The next one is the 2-0 drill, which is the pilot drill, and so on. We have 2 5mm drill, 2-8, 3-2, 3-6, 5, 4-2, and 5.2 millimeter drill. We have here the screw in order to put the screw inside or on top of the implant to close it. If we go further, we see the parallelity tools, 4 in number, which we need to see or to terminate to see our parallelity when we put more than one implant. If we go further, we will see the carriers, and in the end of the kit we see the ratchet, and we see here an instrument in which we can use for measuring the depth of the drilled hole. We go further, we see the surgical instruments we need for our operation. We have the suture 3-0 silk, we have the scissors, we have the needle holder, we have a coretta, we have a pincetta, we have the scalpel, and we have the flap elevator. In the left side we see our implants in packaging of 6 pieces in the box, and we can see, like from outside, the diameter and the length of the implant we need. So we can take now the right implant out of the packaging, the big packaging, and we can open it this way. It opens like this. Then we can draw out the implant itself. Before we take our implant out, we have the paper coverage here we see 3 sticks, which 2 of them are for the surgery and one is for the patient. And now we see here that the coverage, paper coverage is not stuck on this side, so we can open it very easy. No, that's not fish. And then we can take our final implant out. It's also very easy to get it out of the box. And then we can take it out of the final tube this way. Okay, and then we have the final packaging of the implant in this way. And now we can take it out and insert it slowly in the hole we drilled before. After presentation of all needs for the operation, so we will start now with inserting our implants. For inserting our implants, or for this case of edentulous lower jaw, we are planning 2 implants in the front area in the canine region. 2 implants, one on the right side, one on the left side, in order to rehabilitate the patient with overdenture. So we are planning now 1 implant in position of 43 and the other implant in position of 33. So I am going to start now with inserting the implant in position 43. For this need, I have to make an incision in this area exactly on the middle of the crystal bone, like this. That's what you should, so. Like this. Then after the incision, I am able to make my flap in order to see the crystal bone. One flap, one side of the flap is the lingual side, which as I am trying to de-reflect. This is the, as you see, the edge of the lingual side of the bone. Then we have the possibility now to de-reflect the buccal side of the bone in order to see the other edge of the bone. And so now, as you see, we can see very well the width of the bone we have. In this case, if we have this width of bone, I think the insertion of an implant of 13 millimeter long and 3.75 width is a very suitable implant. So the first step is going to be the drilling the hole for the implant. I am starting now with a marking drill in order to mark the positioning of my implant. So I take the flap elevator so I can see my bone. Then I look at the physiodiscipline, the motor, and I see that I have 800 rounds per minute. I think it is a good number now for my situation or for my bone. But if I feel like the tactile feeling of the bone that it is D1 or a harder bone, so I can go up with my rounds per minute. So I am starting now with a marking drill and try to position my implant. So I try to position it exactly in the middle here of this nice bone and wide bone. The next step is going to be with the pilot drill, which is 2.0 in diameter, and as we see here, has a white color, and every drill of our system has another color, as you see the pilot drill with the white color. Now I take it out and try to drill my hole with 2-0 pilot drill. Now we dereflect again the flap, and now I try to drill as parallel as possible for my situation, and I orientate myself on the frenulum of the tongue. I let the patient take up his tongue in order to see the frenulum, and I try to be as much as possible in parallelity to the frenulum. So I start now my drilling. And I drill very slowly, and we call it the dancing method, up and down, in order not to produce heat, so we will have no necrosis of bone, in order to have a very good success of the implant. Now I go to the marking of 13, as you see, and I am finished with the pilot drill 2-0. So I put it back. In order to be sure of my direction of drilling, I have the possibility with the parallelity tools to examine the situation. So I put it inside the hole which I drilled with the pilot drill, and I can control now if I am in the right position. And as you see, there is a good possibility that I am very parallel to the frenulum of the tongue. So I can now take it out and get it back. Now I can go further with the next drill, which is 2.5 with the yellow color. So now I am again drill in the same way, also slowly in order not to produce heat, and in the same time in the bone dancing method, till we reach the depth of 13 millimeter. Okay, the next step is going to be the drill of 2.8, which has, as you see here, the red color. I take it out and go further with my drilling. Also in the same way, bone dancing method, until the marking of 13 millimeter. I get it back, and then the next drill is going to be 3.2, which has the color blue, as you see here. Okay, so I think this is enough in this case with the drill 3.2 for inserting implant, 3.75 and length of 13. In case of harder bone, we have the possibility, as you see here in our kit, the possibility to drill also with the drill 3.65, which has the green color. But in this case, I decided, because of the good bone, or because of this kind of bone, I decided only to drill till 3.2. We have also now the possibility with the countersink, which you see here, to prepare the crystal part of the whole of the bone drilling, to prepare it even well for the inserting of the implant. So we do this with the countersink, just for 1 or 2 millimeter inside the hole, and this is enough for inserting a perfect implant in this hole. Okay, now we can take our implant, which is already taken out of the package, and now we can take it out finally in order to insert it in the right position. As you see here, this is implant of 13 millimeter and diameter of 3.75. We take it like this and try with the hand manually to insert it for 1 or 2 millimeters in order to get good primary stability. I take the ratchet out, and you see this is a torque ratchet, and the sign of in and the arrow in the direction of the torque. I put it on the carrier, and now I have the possibility to insert my implant inside the jaw. I do it slowly in order not to produce too much forces and to not to produce any necrosis of bone. And we see here that our implant is going very well in the bone, in the hole, without no problem. I have the possibility now always to control how deep I am. Okay, I keep just one half or 1 millimeter further in order to get the implant on bone level. So as you see now, I have the implant exactly on bone level, a very good positioning of the implant, no space with the crystal bone. It looks nice. Now our cover screw is like you see here on the top of the carrier. So I am going to take it out with our screwdriver like this. And now I am able to cover the implant with the cover screw. Okay, this is ready implant as a submerged implant inserted in the position of 4-3. I think it is in a good position and exactly like the way it was planned. Now we can suture our wand. We have our suture, is a silk 3-0. We take it out of the packaging. And we start suturing. We have here the possibility to make a continuous suture. On the other hand, we can also suture here with separate sutures. The second one is going to be here. In the same way. And the last one. Okay, so we see here now a closed wound with 3 sutures, and the operation is now finished. Okay, as you see here, we inserted the implant in position 3-3 in the same procedures like the implant in position 4-3. 3 months later, the patient comes back, and we begin with the reopening of the implant in order to take the cover screw out and put the healing cap on top. We take the cover screw out with the screwdriver. The healing cap, it comes like this in this package, which we open here. And as you see, you can see the length of the healing cap written on the label. Okay? So we take it out. Okay, now can we put the healing cap on the top of the implant? We can close the wound around the healing cap again. Okay. In the same procedures, we reopen also the implant 3-3, and we can put also a healing cap on top of it. After 1 week or 10 days, the patient comes back after the gingiva healed around the healing caps in order to put transfers and make impression to send it to the laboratory. Okay, we take out the healing caps and we put our transfers. The same procedures on the other side. Okay, this we can screw it in the implant. Okay, so we have now transfers. One is open and one is closed. And then in this situation, we can take impression in order to send it to the laboratory. So after taking the impression with the transfers, we send the impression with the analog which suits to the transfers to the laboratory, so they can have the same situation which we have in the oral situation or in the mouth, the same situation in the laboratory, in order to start making us our crown. Okay, this is the last step of our procedures. We are going now to put a straight appointment on top of the implant in order to put the crown on it as a final step of our work. Okay.